I will start with this case scenario from our real life. This is a male patient, 45 years old, no past medical history. He has been presenting to us with persistent atrial fibrillation for 6 months. His ejection fraction was low, 45%, moderate mitral regurg, moderate tricuspid regurg. His left atrium was dilated, 5.7. His CMR did not show any scar or fibrosis, and he has right ventricular preserved function. What should I do for this patient? Rate control, cardioversion and amiodarone, or cardioversion and ablation. According to the guidelines in the ESC, AF catheter ablation is recommended in patients with AF and reduced ejection fraction, as Sam said, and with high probability of tachycardia-induced cardiomyopathy. The American guidelines in the ACC showed the similar recommendation to go for catheter ablation in recurrent paroxysmal AF with reduced ejection fraction. So, let's review the available literature. This is the ATTACK trial, which compared catheter ablation with amiodarone, and their primary outcome, secondary outcome, was achieved in catheter ablation arm. So it resulted in significant improvement of left ventricular ejection fraction, 6-minute walking distance, but and also with a relative reduction in the hospitalization and all-cause mortality, and that was the study. Some analysis of the Cabana trial, which Sam showed us, that showed patients with concomitant atrial fibrillation and heart failure showed a reduction of the primary composite endpoint of death, disabling stroke, serious bleeding, or cardiac arrest, and all-cause mortality by atrial fibrillation ablation, compared to drug therapy for rate control or rhythm control. This is the New England Journal of Medicine, which studied the catheter ablation for atrial fibrillation and heart failure, and again compared catheter ablation to medication, to drug therapy, and the primary outcome was achieved in the catheter ablation arm significantly compared to the medication arm, and also all-cause mortality. So, catheter ablation, they concluded, for AFib with heart failure significantly lowered all-cause mortality, hospitalization, or worsening heart failure on optimum medical therapy. And these are the results in this graph, clearly showing their significant results of catheter ablation on death hospitalization, death from any cause, or hospitalization from worsening heart failure. This is my favorite study, the Castle Heart Transplantation Extended Trial. Sameh showed us, but he didn't go into the detail. In this study, it was planned for patients with end-stage heart failure and atrial fibrillation who are on the list for transplantation, and meanwhile to go to receive LVAD as an intermediate stage until they get the suitable heart. And this study, in this study, showed that patients who received the AF ablation with catheter ablation, their primary outcome from all-cause LVAD or urgent heart transplantation was lower in those who underwent AF ablation and was significant. And the secondary outcome also, all-cause mortality, was significantly lower in those who received ablation. LVAD implantation as bridge to transplantation also was low, and patients were taken out from the transplantation list after doing this ablation, and that was significantly shown in all these graphs. The blue line is the ablation, and the red is the medication, and we can see here all-cause mortality, LVAD implantation, or being in the transplantation list. Camera MRI, I like the name, which studied the left ventricular ejection fraction and the scarring by late gadolinium, and this included the persistent AF patient with idiopathic cardiomyopathy, ejection fraction less than 45%. They underwent MRI before and after, and it showed that there is significant increase in the absolute number of ejection fraction اللي انتوا بتقيسوه في الإيكو لاب, and also showed normalization of the ejection fraction, as we can see here in this comparison. atrial fibrillation with heart failure ejection fraction, reduced ejection fraction, and that was in last November 2025, and that was published in JACC, comparing catheter ablation with antiarrhythmic drug therapy, and showed that ablation superior to medical therapy in heart failure patient with atrial fibrillation with marked significant increase in the ejection fraction. Now, in the Indian Journal of Electrophysiology, they made a multi-center اللي هو مالتي سنتر مش مالتي سنتر اللي هي اللي بيجمعوا ايوه شكرا يعني meta-analysis of all studies, and we can see from these graphs that in this arm, this is the catheter ablation, and all these studies, Marouche وكوك وشون وكل دول showed us that catheter ablation in this meta-analysis was greatly significant in all-cause mortality compared to the medical therapy arms. All these studies, والله. This JAMA 24 showed that atrial fibrillation ablation in heart failure with reduced or preserved ejection fraction in these 12 RCT trials with 2,400 مش النمبر الصغير اللي انت وريته لنا يا سامح, that all these participants showed catheter ablation was associated with reduced risk of heart failure events in those patients with reduced ejection fraction. And also all cause mortality of cardiovascular death. مش بس كده, ده في الهارت ريزم اللي يعني ما بيقبلوش حاجه بالعافيه. catheter ablation for AF in patients with heart failure reduced ejection fraction. This meta-analysis, same. Heart failure hospitalization, cardiovascular mortality, all cause mortality, AF burden, quality of life, left ejection fraction. This favors ablation compared to medical therapy. Again, randomized trial, ablation-based rhythm control versus rate control. The RAF showed statistically non-significant survival. Yes, but because of what? Because of what? They used this 95% of patients were in persistent. Persistent يعني ايه AF أقل من سنة. طب AF أقل من سنة ده اتأخر قوي. او لونج ستاندنج. لونج ستاندنج دي انا شخصيا ما جلش، لكن الاستادي دي قالت ان البيشنتس اللي هم عملوا كاستر ابليشن لون ازرق they have less recurrence of AF. شايف الاحمر ده كله دول عينين خدوا الميديكال ثيرابي وفضلوا في الاي اف لانه بيرزيستنت وما استفادوش. طيب ده مش بس كده يا سامح. تايم تو ابليشن، ما تخليليش العيان تخلله لحد ما يبقى بيرزيستنت ولونج ستاندنج بيرزيستنت وتقول له بقى روح اعمل ابليشن، لا ده من الاول على طول. سو تايم تو diagnosis دول اشوف في الستاديز دي في وقالوا ان diagnosis to ablation time of 1 year or less was associated with 27 risk of AF recurrence compared to more than 1 year، وده اللي احنا بنشوفه في البراكتس بتاعنا. And this is their results. Again here early versus late AF catheter ablation for clinical outcome ورت لنا هنا ان early intervention is better to minimize hospitalization, AF recurrence and improving ejection fraction. طيب بقى سامح قال الكوست. التايمينج هنا again التايمينج should the same here. catheter ablation cost. الكوست يا سامح ده مهم صحيح. الدولة بتدعم الاي اف ابليشن في التأمين الصحي وفي علاج نفق الدولة، ده معناه الدولة بتفكر معانا احنا نفيد الناس دي ازاي. لو كان الكوست ده ايشو ما كانوش عملوا كده، لكن الكوست ده اقل في العيانين who underwent catheter ablation and this is from this study which was published 2020 and the reduction in cost was observed in these admitted patients. We are not finished yet because we have different techniques. We have the cryo, we have the pulsed field, less complication and follow-up. Back to our patients, he underwent ablation and he back to sinus rhythm and follow-up 12 months, he's back to sinus rhythm, ejection fraction 60%, left atrial diameter decreased and anti-failure treatment was stopped. So my take-home message, early AF ablation makes the difference in AF patients. Yes, okay, خلصت. بس a class 1 indication, American Heart 2A in ESC, multiple randomized controlled trials in patients with reduced ejection fraction have shown that ablation improves symptoms, quality of life. عيان مش رايح جاي على المستشفى with a rate compared with rate control or antiarrhythmic drugs with their own complications. Although in the past a trial of antiarrhythmic drug was advised before pursuing catheter ablation, current data support ablation for AF as first-line therapy and even before antiarrhythmic drug. And as Sameh said, in Egypt we have many centers who can perform AF ablation safely and successfully, and the results are like any other result all over the world, which is more than 70%. But don't wait, send the patient for the proper center with the experienced people, and thank you very much.
شكرا جزيلا.